So thank you so much, everybody, for joining us. We're gonna get the party started because we've got lots of cool stuff to share with you, and also want to give an opportunity for people to ask some questions, just because some of us that are presenting today have been through the ringer on point-in-time counts for many years. So this is one of those years that is, completely out of whack all around. So we want to make sure that we can hear from you and help answer some of the questions that are pressing for and top of mind for you as well. For those of you that are just joining in, we're just throwing in our names and where we're joining from in the chat, just so everybody has a chance to see who's in the Zoom room. And we'll get started. So Jesse, do you want to forward to the next slide? So I wanted to start with a land acknowledgement, and in the spirit of reconciliation, recognizing that we are help seekers on the traditional territories of the Blackfoot Confederacy, so the Siksika, Kainai, Piikani, the Tsuut'ina, and Nakota Nation, and the Métis Nation Region 3, and those that make their home in Treaty 7 of Southern Alberta. So obviously we are acknowledging this territory as where most of us are, but there's all of you that are joining from your territories as well. And I'm sure you're doing your work in reconciliation, and the traditional acknowledgement is just part of that work, but an important one as well. And those point-in-time counts that you're going to be undertaking are similarly going to be doing this work on traditional territories. So we're encouraging you to think about that in this work as well. Next slide, please. And we're up to 138 participants. So that's awesome. So just what's on tap for today, and the reason it says number 1 is because they're all super important, not because the formatting got screwed up. So I wanted to have this opportunity to talk a little bit about doing a point in time in the time of COVID, because that is very different context, and then give you some understanding about why we're doing the PIT counts and how it relates to a bigger understanding of homelessness. And a lot of the time, the point in time becomes an exercise in bureaucratic enumeration, and that's not what it's supposed to be, or it shouldn't be. So how do we get the maximum value out of this work? We also want to talk a little bit about the data analysis and insights you should be getting out of your point-in-time count, and what that means for policy and practice as well, and how we can streamline the analysis work. We wanted to give some of our colleagues that are doing this work and have done the learning from the bottom up. And so Marty from the city of Lethbridge is going to be here and chat a little bit about Lethbridge's plans around the point-in-time count and how it fits into their bigger strategy and work around homelessness. And then lastly, we've been developing a whole slate of tools to help communities figure out how to do the point-in-time count work in a more streamlined way as well. So take away some of the pain in terms of analysis and report writing in particular. How can we make that, bulletproof press of a button versus having to wait 4 months to write a report, clean the data, and all of that. So we'll share some of the stuff that we've got on tap to support communities that are wanting to make this slightly less painless this time around, because we could all use a little bit of help this year, I'm sure. All right, next slide. Okay, so those of you that don't know Help Seeker, and I did give some shout outs because lots of you do know about us, but those of you that are new, we're a social innovation and technology company based out of Calgary. We're a B Corp, so not a traditional charity, not a traditional nonprofit, but also not a traditional corporation. We're somewhere in the middle. And so we develop tools and technologies, processes to scale social innovation and move systems change forward, and leveraging the best of our thinking in social innovation and evidence-based practice, but also bringing technology to bear and make our life easier and more streamlined in the process. We started in 2017, so not that long ago, but we're up to about 33 staff now. And the big reason for that is because of all of you and all your support for our work. So as we expand, the revenues that we bring in gets spun out into new products and then into expanding our staff so we can do more. So thank you, all of you, for your support of our work, because this wouldn't be a thing without all of you. And then our partners are primarily through municipalities, system funders, and then NGO. So lots of the service providers are our partners. The people with lived experience that use our applications that are, in the Google App Store and on the web and all of that, that's all part of our success. And yeah, a huge thank you to everybody for all of this, because it's been a beautiful and really tough experience, but really, really cool experience as well for all of us to be able to bring all this cool stuff back to the community and test it out with you. Next slide. Okay, so a little bit about thinking through decision-making around homelessness during COVID, and just to lay the groundwork for what we're going to be getting into from a more technical perspective. The reason for the homeless count, and I'm not going to speak out of turn to say that reaching homes mandating of point-in-time counts is not simply to get a number from all of you for a tick mark exercise. It really is to encourage communities to have evidence to make data-informed decisions. And so the challenge, of course, is that we need to find that balance between being responsive and action focused and still having the evidence base to inform that decision. And that's, I think, the big challenge with the point in time count that I've seen in communities is it often becomes a bit of a bureaucratic exercise and something that we have to do because so-and-so is mandating it, and the line of connection between those numbers and the insights from that data into practice change and policy advocacy is sometimes not very clear, which is so not the point. Of course, you're not asking people to participate in this, you're not engaging volunteers only to put away that report until next time. So we want to think about that through a little bit with you and give you some insights into what's possible as well. So want to definitely strike that balance. You want to make sure that you're not over promising, but you still want to make that connection and line of sight to action so that you can feel good about doing this as well. And, at the end of the day, we are using taxpayer resources to do this work. So it's money that could be going into frontline delivery. So we want to maximize what we're getting out of this as well. Next slide, please. So I'm going to punt it over to Jessie to tell us a little bit about how this applies in more technical terms as well. And the reason for bringing Jessie onto this, some of you may know her from her time at the Canadian Observatory on Homelessness, where she was known as the Pit Queen because she oversaw all the technical assistance around the homeless count. So she's definitely our go-to internal expert on how to run these and has been there, done that with many of you already, but I'll let her speak now about her take on this.
Hi, everyone. So welcome to my home. For my fellow Ontarians, I know it was state of emergency called yesterday, so I hope everyone's safe and well and same across the country. So I'll give you sort of a brief and boring history of my relationship with point-in-time counts. So in 2015, I convinced COH I knew what a pit count was somehow. And over the next 3 years, I supported the development of the national methodology alongside many of you. So I guess I want to say I have great sympathy for the task that you're sort of undertaking this year. And though it won't be an easy one, I do think hopefully together there's ways that we can derive some value out of the pit count this year. So enough about me. So we have a new tool here at HelpSeeker we like to use. So if I can ask everyone to pick up their phone and go to menti.com. If you put in the code here, then you can also answer this question here. And so we'll get a feel for who's in the room and who's joined us today.
So there you go. So menti.com, and the code is this 5568190. Yeah.
And so we're just wondering what everyone's role in pit counts are. And if you don't have sort of a direct role in pit counts, what's your role in responding to homelessness?
I'm going to do it too.
Okay, so we have a coordinator, community developer, help people get housed and maintain housing, rural homelessness count, great. Administering the pit, just here to learn, awesome. My role is to break the wheel, I love that, that's great. Director of data from CAH, hello. Systems development, let's see if there's, oh, there we go. Was planning to volunteer, but then COVID happened, yes. Employee of Help Seeker, thanks guys for the support. Frontline shelter worker, no direct role, data collection analysis. Okay, so it seems like we have a good cross-section of people. We'll go through. We have a community coordinator. Okay. Let's do a couple more. Ensuring safe implementation of PIT during a pandemic. Totally understand. When we did the PIT count guide in 2016 and 2018, none of us had the foresight to create a chapter on conducting a PIT count in a pandemic. So I appreciate that you guys in some sense are on your own, and hopefully we can help in some sense. Coordinated access, furniture bank rep, here to learn. Okay, so we're gonna go to the next question if everyone's ready. And here you can be honest, but in a few words, how are you feeling about the 2021 PIT count? Hesitant, fair, unsure, nervous, hopeful, concerned, of course, need to delay, excited, curious, unsure, that seems to be resonating across the group, skeptical, not going to happen, okay? And we appreciate too, communities are coming from entirely different circumstances related to COVID, but also related to PIT. So all of these feelings, I would say, are valid. Curious, yep. Organized. Irresponsible government, okay. Not sure, quite sure why. Ready. Okay. So I won't say today within this PIT count we can kind of allay all your concerns, because of course that really is up to you at the community level and reaching home, and also sort of provincial medical advice. But I will say over the next couple slides, I will offer some ways I think we can get value out of the PIT count, but that doesn't preclude all of your feelings about it, and that there's individual circumstances, and communities right now are trying to keep people safe. So I'm not blowing that off in any way, and I want to recognize and appreciate that it's a much different circumstance for people across the country. Okay. Oh, okay. I will also say it's fantastic to see that there are some communities that are people who are feeling more hopeful, and I hope we can leverage that to sort of collect the data we need, given the kind of demands, decision-making demands that all of you are facing right now during COVID. So I was looking back to 2015 and I was thinking, what did I want to say to you? And sort of what stuck out for me is, despite a consistent methodology and despite core standards, over the two counts, I was struck at actually the vastly different ways communities derive value from point in time counts. So I think in COVID, there's another opportunity to do what we've always done, or what you've always done, and say, how do we make this work for us, and how do we make this work for us now? And so of course there are new constraints, but I also recognize there are new data requirements, there are new data needs, there are new things we need to know. There are new things I believe we need to measure responsibly if we are to make decisions this year, but also for the coming years related to homelessness, particularly given some of the impacts we're seeing related to COVID. Why do we still do PIT counts? I get asked this a lot. Of course, I'm a biased party. I get asked this by some of my colleagues. And so what I think the interesting thing is communities all have a different answer for this. And so this year, again, I think it's about, why are you doing a PIT count this year, and seeing if you can find that value. And some of the value might be the same as it was for you in previous years, but there might be a new impetus or a new reason or a new data that you need to collect from the count this year. And so it's an opportunity just to sort of pause and think about that. So in some communities, it's the main source of data. I know that's hard to believe for some communities, but for other communities, it's a really important piece of data to measure homelessness and also for accountability on ending homelessness. In some communities, there's incredible administration data. So the PIC count serves as sort of a supplementation of that. It's a long, I don't know why I put this word on my slide because I can never say it, but a longitudinal picture of homelessness. The PIC count, of course, provides year over year, not only at a local level, but sort of a provincial and regional level. Person-centered service planning and delivery. So some communities use it as an opportunity to every 2 years ask people experiencing homelessness what they need from a service and delivery standpoint. And that's an important feature of the count. So the survey piece is really important. Some communities use it as, so communities that don't have a robust outreach resources, they use it as a way to piggyback outreach, provide resources, provide supplies, different kind of outreach efforts that are attached to the back of the PIC count. There's also regional, provincial, and national aggregations. So we have the 7 cities. Ontario, of course, there's a standardized-ish count. BC, so there's some value in looking at it that way. Relationship building. So in some communities, especially I think newer community entities, it's an important rallying point for service providers, for volunteers, for people experiencing homelessness, for people to come together and to collect data and set priorities related to homelessness. Accessible data for all communities. So a really interesting thing I would hear as a PIC count coordinator was, well, we have that data. We already have that data. And that's fine, but who has that data? So if your data is sitting in your information management system, but it's not accessible to the public, to the media, to people experiencing homelessness, then I think we have to have a conversation about if there's data already in a community, is it transparent and is it available for everyone to use? And then I can't see my last point here. Oh, political leverage. So sometimes it's useful in conversations with province to show rates of homelessness or increase of homelessness. So communities use it for that as well. Value in 2021. So here we talk about how have your needs changed and how could you make it work for you? And I won't pretend all of these things will be useful to everyone, but 1 or 2 of these things might resonate with you as a community, and I'm sure you'll have more. So what do you want to know? Of course, there's the impacts of COVID on homelessness. If you have another way to measure that, cool, that's great. The PIC count won't be your primary way to do that. Racial equity in housing and homelessness. I think this is a huge opportunity for 2021. So the COH has a question on racial identity, and I know some communities have used it in the past. I understand it will be a core question this year. I might have that wrong, but I think it's an opportunity across the country to see sort of racial disparities and inequities related to homelessness. And I think we have a responsibility to collect that and act on it. Also changing profiles and experiences of unsheltered homelessness. So of course, here I'm in Toronto, and we've seen a huge rise in visible homelessness. So who is that? What are those people's experiences? And therefore, does our response to unsheltered homelessness need to change at all because of COVID, again, changing profiles of homelessness? These are just hypotheses, but until we have that data, we can't really act on it. And so what do you want to do? You can use it as an opportunity to share information, community resources related to COVID or not. So information's on vaccines, COVID safety, services, testing. If you don't have a strong outreach sort of resource base, then can you use the PIC count to try to disseminate some of that information, especially in, say, regions where you have to cover a huge amount of space. Distribute COVID supplies, I mentioned. Address community stigma and tensions. So again, I will speak from a Toronto standpoint because we're the center of the world. I have seen, I think, a notable increase in sort of NIMBYism and community backlash to encampments. And so there's a lot of conversations happening around that. And I think the PIC count data presented well could be an opportunity to sort of address some of those stereotypes and tensions. It's one tool to do that. There's also solutions-based funding. So can you go through your PIC count questions and think, if we see X, is there a way we can quickly respond to that? So one example might be eviction prevention money. So people are receiving COVID, communities are receiving some COVID funding. So can you divert some of that COVID funding to immediate needs that you're seeing in your point in time count results. And then developing or enhancing a coordinated access system. So some communities are enhancing their coordinated access model right now. At Help Seeker, we sort of take what we say integrated coordinated access. So we look at coordinating beyond just the homeless serving system. So what information can you pull from the point in time count data that would help you inform an actual systems coordination plan? That's that. What did I think next? Oh, it's back to you guys. I strategically gave myself a break every 2 slides. So given the unique situation in your community, what value can the PIT count bring you this year? And I won't ignore that for some, I think it feels like there isn't a lot of value, but for those that do feel like there is value, what might that be? Mm-hmm. Rapport building in the community. So that's that sort of rallying point. That's interesting. Numbers to compare to pre-COVID. I think that's huge. Up-to-date data, COVID, political leverage. Yeah. Opportunity to address the causes of homelessness, measuring racial inequity. Appreciate that. Unnecessary busy work. I appreciate that perspective. In some communities, you haven't found quite the value of it yet. We've been doing them since 1999. I think I know who that is. Opportunity to refresh or validate by name list, of course. So I forgot in my list of values, communities also use it as registry week, an opportunity to look at their by name lists. Better understand trends, gaps from previous counts. Interesting. I'd be curious to hear what those are. Racial inequities, good media. Yeah, I think the role of media and sort of putting a public effort on homelessness in some communities can't be sort of discounted. How many people are affected by homelessness, racial inequity, larger goal? None. We have the means of getting the data. Okay. Opioid deaths. Yeah. So there is certainly an opportunity. We've heard from multiple communities that opioid deaths is a high priority, and there is an opportunity within the survey to unpack that a bit. So that is a piece of value that could be seen from that data collection. More obvious and harder for people experiencing COVID, public education opportunity, absolutely. Transparency, you'll be supporting ICA. Awesome, thank you. So we really appreciate these responses, and I hope you appreciate seeing them from each other as we kind of collectively fumble our way through this, so to speak. What I'll leave you with, I don't work for Reaching Home, so please follow Reaching Home guidelines. If any of us say anything that sounds like it's contravenes guidelines, it's probably true. We don't know everything, so please defer to Reaching Home guidelines. Follow your local, provincial, national health guidance. This is my legal disclaimer. So of course that comes first, and conducting the count safely is what's most important. And then honestly, don't try to boil the ocean. I think I was bright-eyed and bushy-tailed coming into 2015 and thinking PIT count can do everything. And even referring back to that PIT count guide, there's a lot of great ideas in there, but you don't have to do everything. And I think especially this year, it's time for us to say, okay, what can we do? And let's focus on the thing that matters. Let's collect good data, and then let's do something with it. So I think that's kind of the opportunity ahead of us. And if there's anything we can do or I can do to help you, we certainly would like to figure out how to do that.
Thanks, Jessie. And a couple of the tips that we're seeing come into from all of you. For those of you that have done, there's some BC communities that have done the 2020 count. So there are some precedents on how to tweak the methodology for it to be done in a safe manner that Reaching Home has also laid out, and that we've captured from communities that are already doing some data collection out there. So by all means, we're happy to share all that with you as well, if that's something of interest, where if you're struggling to figure out how to adapt your methodology during COVID as well. So let us know if that's something that you want to know more about. So I'm going to turn it over to Chantel to talk a little bit about the data analysis aspect of the PIT, because the The other challenge that we see doing this work is we can mobilize the community, we can get the surveys done in the sector. We can leverage technology to, instead of doing paper, for instance, and pens and things like that, we can do it on apps now, which is obviously really, really useful for data consistency. But then the data comes in and it takes months and months and months of data cleaning and sorting and analysis. And so there's a huge time gap between the data collection and the actual production of a report, which of course you're kind of losing that political edge. You're not bringing the evidence to bear in a real time, and as real time possibilities as you could be. So there's a couple of things that we've learned along the way around the data analysis that Chantal will share with you as well. Go for it, Chantal.
Great, thank you so much, Elena. Next slide, please. All right, so just a little bit about me. I've been working with Elena for 10 years, and I've managed to have the pleasure of doing point-in-time counts in several different communities around Canada. And trust me, everybody does things differently. So I just want to frame my discussion, I guess, around a couple of assumptions here. And also, it's my opinion, not necessarily held by others. Basically, these point-in-time counts require 3 months to prepare. So therefore, in my thinking, I would also like to see another 3 months around the synthesis of information. The analysis and cleaning should be easy if you're using the HIFIS module, which is my second assumption. So that is something that Reaching Home provides. So please get in contact with them to get yourself set up. And my final assumption is that the survey is done not just on the street, it's also conducted in shelters and also in provisionally accommodated programs and also magnet events. All right, next slide, please. So I just want to have a bit of a chat about the core questions and the Canadian Observatory questions and ideas for your own custom questions. Basically, the number one most important aspect from these point-in-time counts is that the federal government gets your numbers. Okay, so that's your priority. And if you're using the HIFIS module, that should be seamless and easy to do. But what I want to talk about is what we can do with these numbers. So everybody, of course, needs to do your standard frequencies analysis with the core questions that are in the survey. But I want to actually look at the special populations and also the COVID lens, given our situation over the past year. Jesse's point, I think, was admin data is very rarely released in our community, but point-in-time data is. And in my opinion, knowledge is power, but knowledge is also compassion. So this knowledge from the pit count is crucial, not just for service providers, but for the general public. It can help bust myths and it can help mobilize the larger community. Most importantly, the survey questions provide evidence, and it ensures that many of the people with the highest needs are taken into account in your community planning with the release of these numbers. All right, so first of all, basically, we are collecting information on single adults, families, and youth, and I strongly suggest that these three populations form the basis of your crosstabs with the rest of the core questions. And then number two, I think you should drill down a little bit further into your special populations. So your Indigenous peoples, your LGBTQ2S+, your seniors, your vets, your chronically homeless, and your hidden homelessness. There is an opportunity in the point-in-time count. One of the very first questions is, where are you staying tonight? And one of the responses is at someone else's place. So this can provide insight into hidden homelessness in your community. So most importantly, and probably most underused in point-in-time counts, is this ability to do cross-tabulations. This disaggregation with these target populations and special populations will provide interesting similarities and differences, of course, to better understand people's needs. And then you can target interventions according to the available resources in your community, or your system of care, your ecosystem, however your local community, I guess, has positioned itself in helping manage and solve the issue of homelessness. So when you do these crosstabs, then you take it to the next step, and then you need to synthesize this information. Look for correlations, identify trends, draw comparisons between the populations, and look for outliers, things that just don't quite make sense, things that are counterintuitive. These are so important because it gives you a sense of what is actually happening in your community compared to obviously 2020 if you did it, and then 2018. So you can do that year trend analysis. Just a bit of a, I guess, a bit of a lens on the COVID issue here. So just from my Australian point of view, the COVID-19 obviously created an unparalleled opportunity to end rough sleep in Australia. Basically, we've got 120,000 people experiencing homelessness there on the last count, and around about 8,000 or so are rough sleepers. And with the advent of the pandemic, around about 5,000 people experiencing homelessness were actually put into hotels and motels. So they were off the street, they had temporary accommodation. And this was a call for the community: invest in social housing or they will go back to the street. But now we're in phase 2 and it's crickets. So this is something that I think you could explore with your point in time count, with this slicing and dicing into your special populations and then using the COVID lens. Now, talking about the COVID lens, we actually have an additional question in the core survey. What was your most recent housing loss related to the pandemic? Sorry, was your most recent housing loss related to the pandemic, and how long ago did that happen? So I think this is super crucial. Some people are experiencing income loss, they're unable to meet their housing cost, whether it's rent or it's mortgages, and they're going to face eviction. Others are facing eviction because the landlords are persisting with other plans, or they're raising the rent, or they want to sell their investment property because of their own personal situation. Red flag Canada, we need to have a database on evictions. So this question, I think, is really important because it informs evidence for housing policy and the provision of housing supports. In the short term, we can collect this information from these surveys across Canada. I mean, every single province and territory is going to be doing this. And this hopefully is going to support rapid policy making that is done well due to the fact that it's a comprehensive national data set quite early on in, well, I guess at year 1 of the situation that we have found ourselves in globally. In the longer term, I think it's important that this question, it brings perspectives on both the changes that are taking place throughout the different communities in Canada and across housing systems, and also perspectives in what is required in order to deal with this crisis. So I think that also needs a crosstab as well with your special populations. All right, the Canadian Observatory questions. I do have a link here. This is a fantastic toolkit for you guys to click on, and you can see steps and how-tos and get a fulsome understanding of how a point-in-time count is actually undertaken. The one that I want to talk about, there's 15 extra Canadian Observatory questions on top of the core questions. I recommend, and based on Jessie's advice as well, that you probably only do 3. I just want to focus on 1 today, and that is going to be the, it's CO3 in the toolkit here. What racialized identity do you identify with? All right, so you've got a couple of different selections there: Indigenous, Arab, Asian, Southeast Asian, South Asian, West Asian, Black or African, Canadian, Filipino, Hispanic, white, don't know, decline to answer. I strongly suggest that you guys pick some of the core questions you think that will be interesting and important to cross-tab just with this question in itself. I think given the situation with COVID, as you all know, like a couple of months ago, like you would have seen multiple newspaper articles pretty much saying the same thing. The failure to record and publish real-time data on the ethnicity of COVID-19 patients is a scandal that is endangering lives. Why? and I'm sure I'm preaching to the choir here, inequities in social determinants of health, such as poverty and healthcare access, affect these groups, and these are interrelated and they influence a wide range of health and quality of life outcomes and risks. So if you want to achieve health equity, these barriers need to be removed so that everybody has a fair opportunity to be as healthy as possible. And this is absolutely 100% mirrored in our homelessness serving sector. So this question here gives us the opportunity to fully disaggregate data so we can look at hidden trends. It can enable identification of which vulnerable populations need to be prioritised, and it can help establish a scope of the problem. And I guess importantly, target which vulnerable groups are visible to policymakers. So if we have this opportunity here at our fingertips to undertake in March, April, whatever date you guys choose, it's going to allow us to look at the cultural perspectives and the intervention methods that can address these differences among the people. It can help you identify needs so that the allocation of human and financial resources are done more accurately and equitably. It allows the community to acknowledge that the racial and ethnic heritage of people that are living there. And finally, it helps us monitor equity in our system of care resources and outcomes. And now finally, some local custom examples. All of these questions in the survey are asking about people who are experiencing homelessness. But I think we do need to have a couple of questions there to turn it back onto them and, what are they actually thinking? This encourages people to reflect and reveal what's important to them. It gives you insight into what they think is interesting and valuable. And this is absolutely worth hearing. This provides richness to the data and a story to the data and nuance to the data and context to your numbers. So I'd really like to see a couple of custom examples there. So I've got a little list there on my page. Okay, slide 2. All right, now we need to talk about what the heck are we doing with all of these numbers? So I'll just go through this quickly. Jessie did touch on these, but I really do want to emphasize that there's actually like 4 main areas that these numbers are crucial to, and that's why point in time counts are so important to be conducted across the nation. It standardizes the data collection and so creates a bit of a level playing field into helping the federal government actually understand needs in the various communities. So first of all, these numbers inform the government about the number of people experiencing homelessness in Canada and also the effectiveness of their own programs and policies in decreasing the numbers. Number 2, the point in time count establishes dimensions of the problem of homelessness, and it can help policymakers and program administrators track progress towards the goal of ending homelessness. Number 3, collecting data on homelessness and tracking progress informs public opinion, it increases public awareness, and it attracts resources that will lead to the eradication of the problem. So it's not just the frontline workers and the service providers that are dealing with this, it makes it a community-wide issue that everybody can have participation in and provide ideas for in order to have collective impact, to bring forth solutions to help solve this issue that we're experiencing in our communities nationwide and realistically globally. And then finally, it helps communities to plan services and programs to appropriately address local needs and to measure this progress around decreasing homelessness and identify strengths and gaps in a community's current homelessness plan or strategy or any assistance around those as well. So that's my, like, why the heck are we doing this? That's my reasoning there for you. Next slide, please. Okay, so how do we go from numbers to interpretations? What kind of story do you want to tell with these numbers? Well, we need to interpret the data correctly, and we need to turn it into a good story. And this can be an intimidating task. So hopefully with the HIFIS module, the data analysis and the crosstabs will be easy. There are a variety of different tools that can help with that as well. Excel can do your work for you, Tableau can do your work for you, or we can do that kind of work as well. But Alina will talk more about that later. The most important thing I want to talk about is what can we actually do with these numbers? So first of all, unless the numbers are embedded in a story that your community has framed, the public is going to use the stories that they know anecdotally or whatever is in their head to make sense of them themselves. So the better practice in this database advocacy is to provide meaning first, and then make sure you use the numbers to support this meaning. This practice helps public understanding around how the numbers are supposed to be intended to be interpreted. It also prompts advocates to make sure that they have actually thought through the larger story of what's going on in the community and what the numbers are supposed to illustrate. So the first question I think here is what is going to be your organizing principle or frame that your point in time count numbers are able to support for the local situation in your community? All right, number two, too often numbers are used to tell a single unproductive story, crisis. Okay, we know we have a problem, and it's a big problem, and that problem is a crisis. And this crisis frame can be quite shocking to people. Most important thing here, never doubt that a small group of thoughtful, committed citizens can change the world. I'm sure you've all heard that before. That's Margaret Mead. Okay, it's so important to focus on what is the story that our numbers can be used to tell that allows people to see the solution. So that's what I also want you to consider when you write your final report as well. And then my last point here is data storytelling is ultimately about understanding the context and inspiring change for action. Adding some kind of like cause and effect text within your report, I think, is also an important component in helping people understand how an issue works. You should be pointing the public to the issues or the trends or the situation surrounding the context. So talk about employment, talk about income, talk about health, talk about safety, talk about core housing, talk about COVID, and then look at the implications of all of these trends and how human decisions have contributed to the situation at the moment. And then I also want you to talk about your policy opportunities that exist to prevent or even solve the problem. Tap into your university, your professors, or even social policy students. They can help add richness to your point in time count report. Don't just make it about the data, make it about the story as well. So what kind of connections can you see here? What are your interesting findings or your surprising findings? And I think this was so important for you as well. And then last of all, quickly, consider your audience. You can see my text there, content, medium, access, and then data visualization. Infographics unify narratives and numbers. So they're a beautiful way of showcasing what's actually going on with your within your community. And of course, my final point, make it inclusive and accessible. Perhaps Google decolonizing data visualization, and this will give you some great ideas. So sorry, I'm running over time. I will hand it back to you, Alina, to introduce Marty.
Well, Marty is a dude who needs no introduction. So, and I apologize, Marty, for like that super close-up picture of you, but it's what we could get our hands on from Google. So, yeah, Marty's he's the guy leading the work in Lethbridge around social development, and obviously homelessness is a huge part of that. So, yeah, I'll hand it over to him to tell you a bit about how the pit fits into their work. And people apparently love your pictures, so there you go.
The gray-haired old man. So thank you, Dr. Turner and your team. I was the fella that on the Menti.com that put in, when you asked about the pit count, I put in excited. I do think it's an opportunity. Now, who is Martin Thompson? Well, I am not a homelessness or social service expert by any means of the stretch. I'm an administrator. for the city of Lethbridge. And really my job is to implement the city of Lethbridge social policy. And I want to ensure all City of Lethbridge investments are coordinated, integrated, and of course, I want to ensure a return on investment like any taxpayer dollar. And we are spending quite a bit of money. We're spending about $10 million per year on social issues, and we want the best impact possible. Now, we're a very small city. And so, you know, if you look at our per capita contribution, you know, it's significant. And again, we want to employ system planning and integration of programming. We want to see a return on investment, and like any other investment, performance management to ensure we are getting that return on investment. And our portfolio, or my portfolio, is quite broad. It's affordable housing, it's homelessness, it's intervention and prevention dollars. And in Alberta, that's our family and community support services program. It's addiction and mental health. It's the Indigenous reconciliation strategy. And of course, any emergency response dollars that we allocate, which is, you know, kind of a key area right now with COVID, and many others. So our social programming, or social infrastructure, I like to call it, it's a critical area and a priority area for the city of Lethbridge. And like other priority areas within the city, we need a strategy, and that strategy must be evidence-based. You know, I always tell people a healthy city requires a strong physical, institutional, and social infrastructure. And for most part, you know, Lethbridge has a strong physical infrastructure, our roads, our bridges, you know, all of those pieces, our water treatment plants, and our institutional infrastructure, our hospitals, our schools, our post-secondary institutions. But we also, that third pillar that's critical that we often ignore within municipalities is our social infrastructure. You know, communities dedicate significant time, effort, and dollars proactively planning their physical and institutional infrastructure, but often ignore the strategic planning for social infrastructure or initiatives. And we often make very quick and reactive decisions regarding our social infrastructure. You know, and we often will spend 95% of our funding downstream on the emergency response because we're reacting to that emergency rather than having that global strategic plan. We have to evolve. And like our physical and institutional infrastructure, we need a strategy grounded in evidence, and one that leverages all available resources. We need that evidence-driven social infrastructure strategic plan similar to what we produce for our physical and institutional infrastructure. So over the last 18 months, we have worked with Help Seeker to create what we call our community well-being and safety strategy. And it's not just about, you know, social infrastructure, it's combining and looking at that holistic picture of community well-being and safety. They go hand in hand. My background for many years is actually in policing and justice, and I am keenly aware of the connection between policing and social issues. And there needs to be that integration and connection. And so to do that work, to come up with that CWSS for short, we did a robust needs assessment, which included significant research and broad stakeholder engagement, huge initiative. We did social asset mapping, where we defined all of the social assets in our community. We, the city alone, cannot solve this problem. This is not a city of Lethbridge problem. This is a community problem, and we need a community response. So we needed to do social asset mapping to define what are all of the social assets in our community, which includes everything from the nonprofits to government programs. And then we did a social impact audit. You know, what is the total amount being spent in our community on social issues? And what outcomes are we generating from that investment? This is critical information. You know, we'll do this work for other areas, for physical and institutional or business. You know, we'll do all types of audits, but that social impact audit is absolutely critical, because I want to know, what programs do we have? How much are we spending on those programs? And what are the outcomes we're generating? So that lack of physical or institutional infrastructure is not crippling our city. For most part, we're doing very well. We've put a lot of time and effort into those areas. It's the social issues that are crippling the city of Lethbridge right now. So why are we willing to exert tremendous time and effort regarding our physical and institutional infrastructure, but we all but ignore our social infrastructure investment as a municipality? We'll have 30 to 50-year plans for schools and water treatment plants or roads. I always use an example here in the city of Lethbridge that we had a big investment on developing and building a huge rec and culture center facility. We spent 9 years and $150 million planning and building our new rec and culture center. It's called our ATB Center, beautiful facility. But we'll make ill-informed and reactive decisions regarding our social infrastructure and programs. Sometimes we'll plop things up in a matter of 2 weeks, and we wonder why we have problems. So the CWSS, or again, the Community Wellbeing and Safety Strategy, was a critical step in ensuring success moving forward. It is allowing us to make evidence-informed decisions regarding our investments in social services, social programs, affordable and social housing. So foundational to the CWSS is the incorporation of strong system planning and integration of resources and programs and robust performance management. That's something that I think has been lacking within our municipality. Is we make these investments, but are we holding the service providers accountable for those investments? In other words, performance management. We wouldn't give $150 million or whatever that amount is to when we build a new fire hall or whatever that investment is, without some level of performance management. So that return on investment is very important. So in line with all this work, I don't want the pit count to simply be another piece of isolated data. Okay, I want to derive value from the pit count. I want solid data analysis. My team can do this, but it's simply not cost effective to do this internally. I have reviewed the project, and from a time, capacity, and cost perspective, the value is simply not there. Help Seeker has the tools, the know-how, the knowledge, and the expertise to do the work for me, really at a fraction of the cost when you consider the total investment of time hours and the reports and generating the reports and doing the analysis. So for Lethbridge, there's great value in not only leveraging Help Seeker to assist with the pit count, but the added value is getting them to layer the pit count information with all of the CWSS data I have. I want them to analyze the pit count data against our community and all other data and info I have, and generate insight that I can use to make the best decisions possible. So some key examples, of course, are, I want to know, measuring the impacts of COVID on homelessness. I want revisiting of trends from previous years, including Indigenous overrepresentation and mobility. And yes, I want them to make recommendations and inform some quick wins, some high impact areas for effective use of COVID funding. We're getting a lot of provincial and federal assistance for homelessness right now. And the biggest fear I have, I'm going to put on my taxpayer hat, is we're not making strategic investments. We're reacting and saying, okay, how can I spend this money? And the last thing I want to do in Lethbridge is not strategically use this funding. And so, we have some additional funding right now, and I want to use it effectively. The pit count, I want them to help me inform our integrated coordinated access design and delivery. Behind the scenes, we are doing a tremendous amount of work on our integrated coordinated access model. It's quite exciting. I'm not going to talk about it now, but If anyone wants more information, I'm happy to share. And it's really, it's not just for homelessness, but it's integrated, coordinated access for all social services in our community. And then, of course, I want to know how we compare on that province or even federal wide picture. So, and of course, I'm a bit selfish. I want all of this in a professional, easy to read report, because I'm going to use these reports and information to advocate for more resources from my city council, from the government of Alberta and the government of Canada. And I want the reports to be, you know, in the analysis and that complete package to be professional, accurate, and very and a lot of value to it. And to be specific, I want to move from simple data collection, which in reality is the PID count. We're collecting data. I want to take that and I want the robust analysis to go with it. Okay. I want to move to analysis to activation now, and with data and leverage points that already exist. So I want them to take all of that other data I have collected, and I want them to layer that with the data from the PID count. I don't want the PID count to simply be another piece of data that sits on a shelf. So yes, I am excited about the PID count. I know it's COVID and, you know, it's a tough time to do it, but you know, the pandemics, even if we get through COVID's going to be with us for a while. There's going to be another pandemic. In my opinion, we can't stop the PID count. We can't stop data collection and analysis. Yes, we may have to change how we do things. We may have to change our methodology a bit, but we are going to have to evolve, constantly evolve as we move forward. And again, as a municipality, I have to be very, very prudent on how we spend our resources and how we get this information. And if I can leverage external sources to help me do it and generate value and information and evidence, you know, that is outside of my team, I'm okay with that. So to summarize, we're excited about this PID count and are going to move forward. Thank you.
Thanks, Marty. The work in Lethbridge is, yeah, it's been so rewarding to see and be part of. So thank you for sharing some of that and how the PID fits into it. Wanted to just kind of wrap up now and talk a little bit about some of the, and just give some props to our team that's been doing some of the work to streamline the PID count process, especially on the analysis and report side. And, you know, we're trying to think outside the box too. How can we use technology to make communities' lives easier? And obviously the Lethbridge and what's happening in Alberta is a really cool opportunity for us to do that, some of that experimentation. So we'll share some of that stuff with you just by way of wrapping up. And then we'll get to questions. We'll stick around for questions. So the principles around data collection and reporting, leveraging again what we have, creating those practical data collection tools. We talked a little bit about the HIFIS app, and again, a props to the HIFIS team that's making that app available free of charge as well. So if you haven't taken a look at it, consider this an official plug for the HIFIS PID module. The other part is leveraging technology to analyze the data really quickly. So at the click of a button, so to speak, and intentionally. So thinking ahead about why we're collecting and what reports and stories we're trying to tell. Making that data available and usable. So in formats that make sense to the people we're talking to rather than just researchers. So we talked about visualizations and data visualization and using infographics and design elements to bring the data to life, so to speak. And then ultimately, it's all about being accountable for the results by taking action. So not just collecting for collection's sake. You heard how Marty talks about using data in decision-making and advocacy. And so making that link top of mind. So let's not produce reports nobody's going to look at. Let's be really intentional in the products that we're using this data to inform. Next slide. So So a couple of the things that we've got on the go right now, and our challenge to our technology and research and data team has been, can we develop some of these tools so that communities can essentially use the HIFIS PIT module to plug in the data, and then we can essentially develop the back-end report and data analysis tool. So rather than a human having to do it, it can literally spit it out, and then we can move on with life and get to the important work, which is the systems change work. So we've developed two products, if you will, for that. One is kind of the standard analysis of the PIT, which some of you would be familiar with. So how many people do we enumerate, the gender breakdown, the crosstabs, so how many Indigenous youth, for instance, would be one. And then there's this broader thing, and Marty's challenge to us was, that's great around the basic PIT analysis, but tell me more about how this relates to the economic situation. Tell me about this homeless count and the connection to core housing need in my community, to poverty rates, to COVID. So wanted to take that more integrated perspective and see where the connection between the homeless count was with these other data sets. So for the Alberta cohort, we've also created this integrated report as well that goes deeper into that piece. And again, the whole point is to automate the analysis rather than us doing this work and taking 6 months and $100,000 in consulting. Click the button, essentially. The other piece, and a little, again, props to some of our machine learning and AI work happening, has been that we've been able to use the PIT data to make the connections between that and other data sets to say, what are the underlying dynamics that are making the PIT count go up or down? And then let's take a look and understand those during COVID so that we know and can anticipate what's happening ahead of us. Because then, of course, it's not just what's happening today in the PIT count, but what's happening next year and 5 years from now if we're on this trajectory. So, because if we can predict it, we can intervene earlier, and we can, in theory, prevent it if we do a good job on advocacy. So that's what that predictive analysis component is all about. A little bit too around the standard data report, and we'll be able to share these slides if you have an interest into this. The challenge was, can we do this rather than in months? Can we do this in a week to 3 weeks? So have that production and a beautiful design report out the door, back into the hands of those of you that are pushing the policy work forward, so that you can concentrate on the politics, on the things that technology can't do for you, right? So make your life easier on the things that are better done through these automated data analyses, and then have you kind of buy back some of your time to do the heavy lifting around systems change. So that's the standard data report. And then the integrated data report, I mentioned a little bit about that too. So just digging deeper into the connections between the homeless count and what else is happening in the community, and then thinking ahead on what's happening longer term, using that predictive algorithm as well. The other thing about this is, and we've chatted with 7 cities on this too, there's also this value of releasing the PIT count and then doing a state of homelessness report later on as well. Andrew's asking if things work with Excel spreadsheets. Yeah, I mean, it's essentially hooked up. We would be looking at an API hookup into the HIFIS PIT application so that everything is automated between those two systems. But yes, if you have a CSV in that same format or in Excel, that would also do the trick. Next one. Yeah, so a little bit too, if you have that need for additional technical assistance as well, and you need that support around methodology design, Marty has this whole like set it and forget it attitude, and some of you may not be in the same boat as him, and you want that kind of more hands-off approach where you just need support on somebody doing the report analysis and writing for you, and you want to do kind of these other bits and pieces, but by all means, reach out to us if you have that need. There's also communities that want that interactive dashboard so that they can communicate to the public in a more interactive way. So having that kind of pretty thing where you can zoom into different aspects of your map and see where, where people were enumerated, or different infographics in a data dashboard. That's also doable as well. And then lastly, the one thing when you go out on doing your data collection, you often have to do some of this work around leaving something behind too. So doing some due diligence on what's available. And so for those of you that have connected with Help Seeker before, you do know that we have apps for people that are looking for help as well. So by all means, you reach out to us. We can send you a stack of printable or app info cards, or just ship them your way, these little business cards. So we're everywhere, and just started and we're now in the GTA area as well. Shout out to CMHC for their investment in Help Seeker to make sure our help navigation apps are available everywhere in Canada. So we're not in the Quebec and Maritimes yet, but we are all the way into Ontario. So if you are one of those communities and want some of those cards that your surveyors want to leave behind as part of that package, let us know and we're there for you. And there we go. Yeah, we also thought if you wanted to have that 30 minutes time with Jesse or myself or Chantel on aspects of this, we're happy to support you on that and just give you our 2 cents. If it says 30 minutes, if it takes us longer, that's okay. Just give you some of that kind of free consulting on your methodology. If you want to run something past us, just get in touch with Jesse and we'll be happy to support you. And I think that's it for us. Happy to take your questions now or in the chat. So by all means, drop them in there, and we'll see how much we can answer until people have to run off. All of us are here for another half an hour to do just the Q&As. So we're more than happy to take any and all your questions.
Yeah, that sounds great. Alina, can you hear me?
Yeah.
Okay, great. So there were quite a few questions that came in, and so I'll read them off now. I just wanted to mention that there was a question earlier on about any resource materials to learn more about the pit count. And so, yeah, there were several resources that were shared throughout the presentation. So Rachel Campbell with Reaching Home has said that then an updated version of the survey is being translated and will be posted soon. But in the meantime, we can find new questions in the PowerPoint presentation from an AMA session that the ESDC hosted in December on the pit count Slack page. So I will share that in the email out that I send to everyone following the webinar, along with the recording and the slide deck. And several other resources will be posted next week in conjunction with the training sessions that will be held on Tuesday and Thursday. So those are COVID-specific resources and with possible modification options. And Tracy Burt also provided a YouTube video link that offers important information to keep in mind when collecting data of First Nations people. So I will also include that link in my email to you as well. So getting on to the questions here. Oh, and sorry, just before we do, Alina, if maybe I should just mention our next, a little save the date for our next webinar, which is going to be February 11th, 9 a.m. Oh, can we go back? I'm not sure. Yeah, 9 a.m. Mountain Standard Time or 11 a.m. Eastern Time. So really, it's kind of a follow-up to this particular webinar and essentially looking at what to do with the data. So putting your housing and homelessness to work for your community. And so this answering the questions of so what and now what. So we hope you can join us. I will send you the link in the follow-up email that I send as well. So sorry, one more moment here. Let me get the questions pulled up. So Jesse, this question came through when you were presenting. So there was just a clarification about, are you sure that the pit count is annual in all areas? I think Alina had responded to this in the chat, but essentially I think it's every 2 years, correct, Lena? Unless you're really ambitious and then some areas do 1 year.
Yeah. Yes, it's every 2 years required. Yeah. Some some communities might have a CRM or a client relationship management software where it's pretty easy to kind of run the numbers more often. But yeah, most of the time, I think it's every 2 years is probably the best bet.
Okay. There was a question that came through about opioid cases, and this also came through when Jesse was talking. The person who asked this, if you have any specific kind of follow-up that you'd like to talk about the opioid cases, maybe please expand. Otherwise, Jesse, if you have any comments about, or Lena, about opioid cases, please feel free to add them now.
Well, I mean, other than to note that, we've had more people die of opioid overdoses than we've had of COVID. I'm not sure, Jesse, if you were going somewhere with that comment. I think it's more that the training needs to. It's not just about public health. Is not just COVID response. It's also the opioid response. Or, I think I would challenge all of us to think about those questions when you're connecting with your public health offices and your medical officers as part of your PIT count methodology, to not just get guidance on COVID specific risk factors to keep in mind and modifications, but also around the opioid crisis as well. And your volunteers needing not to just be prepared for one type of public health emergency, that we're in 2 public health emergencies as we speak. But Jesse might have something else.
That's a great point, Alina. I hadn't considered the volunteer training aspect. So there's certainly that. I think I was also thinking there are, I think, 2 questions in the core questions that relate to substance use as related to homelessness and people's reason for loss of housing. So I think also, again, there's just another data point that may or may not be useful given what your community already has to work with as far as insights into substance use related to homelessness.
Great. Okay. Well, thank you so much. So the next question, well, there was just a comment that was brought through, and it was kind of answered also in the chat, but I'll read it out to everyone just so everybody heard it in case they missed it. But someone made a comment that would it not make sense to have a standardized template for PIT data analysis in concert with the standardized questions? It could help identify a generic approach and 10 to 20 key crosstabs that could be done in all communities. So yeah, that's a great point. That's a great opportunity to create some consistency across communities while allowing for local flexibility as well. So another question that came through was, are reports well received by council? I imagine you're inundated with reports all the time. Is there a preferred complementary tool to a report? And that came through, I think, while Marty was talking. So Marty, if you have the ability there to answer that question.
I think Marty had to run to his next presentation, probably a council meeting. How are things received? It really depends. I think PIT counts are always political. So it really depends who's running the PIT count. Is the PIT count being run by the actual municipality, or is it run through a kind of a different entity? And what's that entity's relationship with the municipality is a big question. I think doing your work ahead and educating council on exactly what we're talking about, the value of PITs. The one hesitation I always find with municipal leaders, political leaders, not necessarily administration, is that they think that by being seen as supporting the count, they're taking responsibility for homelessness on their own. And and the challenge with that, of course, is that municipalities are really part of the picture when it comes to homelessness, not the full picture. So they always are hesitant to kind of absolve the provincial and federal governments of funding and accountability, policy accountability for the homelessness challenges. And in a way, they're right about that. It really takes all levels of government to do this well. And majority of funding does come through to the social safety net from the provincial levels. So they need to have support from you guys that are doing the advocacy work and arming them with those key messages to provincial governments as well. And then the same thing, educating city council is not where it stops. You need to be educating the administration and the political level within the province as well. So that's why I think I really like the way 7 cities is organizing themselves, because they've got kind of consistent messages and they're releasing reports in a really strategic way from all 7 cities at once, rather than kind of trickling things and then getting kind of caught up in methodological battles like, well, Edmonton, Calgary, da 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 da. It's like, no, one voice, one methodology, kind of a blitz of reporting, and then consistent key messages to municipal, provincial, and federal levels. It's really intentional.
Alina,
Go ahead, Jess.
if I could add to that, I'm just reading the question. Is there preferred complementary tool to report? So going back to our presentation, something we've been piloting with a couple communities is in fact those data dashboards, because you're right, the reports, long data reports are difficult for anyone to go through, but a council who has many reports. So the data dashboards are one way to try to mobilize that knowledge in a way that's more digestible.
Mm-hmm. Yeah, you're putting yourself in the shoes of the people receiving the information. I don't know anybody, including myself, that's going to read 100 pages of like details and all that kind of stuff. Now, I want to have it. I want to have that spit out. So if I do need it and I get called out, I have it in my back pocket. But I also want that snappy, what does this mean? And it's that whole so what, and then now what? That needs to be spelled out. Now there could be ways that you can massage that content once it comes to that decision maker, but decision makers want support to make decisions faster, quicker, in an evidence-informed way. So if you just give them 200 pages and tell them, well, I think the data speaks for itself, it doesn't. And people will defer to being lazy because they've got so many competing interests right now. So they're going to say, like, you need to do that extra step for them. So it's a really good point. We need to just do that extra work so that they.
Alina, Marty is here. Yeah. If you want me to follow up on that.
Oh yeah. Sorry, Marty. I thought you had to run, but yeah, go for it.
So unfortunately, I have to appear in front of council a lot. And quite frankly, it's not fun, but it's an opportunity. And what I found is you can't give them 200 pages. They won't read it. They can't read it. They don't have the time, and they don't have the expertise or background to understand the context. So it's important that I'm able to present a document or report and provide that context. And again, more so, they want to trust that the process on getting this information is solid. And so they want, my council is keenly aware of the pit count and the way that data is thrown around across Canada. But it's very important to make sure that they take that data and that it's layered with other pieces of data that we have, and that that again they can use to make solid decisions. So again, you can't overwhelm them with 200 pages of documents. They want, and like anyone, they want a solid, professional looking document that they can review. And then of course I appear before council and they'll ask me questions. I'll give them that backup context. And again, that process on getting that information is so important to say, it's not just a number. Here's what we did. And here's how we have integrated and layered it and analyzed it. And, when you use expertise, in the field, it brings weight. You can leverage that and say, it wasn't Marty who did this, right? We had a process, and here's what we did, and here's the steps, and here's what the outcome was. And it's no different than any type of data collection and analysis. So in it, it starts with, you have a question. What is our homeless? Whatever that research question is. And then you need to identify, what data do I need to collect to give me the best evidence? So that collecting the right data is critical. And then third, analyzing that data. You can analyze data in all different ways, quantitative, qualitative, right? But it's identifying the best methodology to generate insight. Okay, now that insight comes to me or city council to help them make the best decision. And I don't know about you guys, but I am not, I don't have a PhD behind my name. I don't, I rely on the experts in the field to help me do that and do it right. So I present it to council and they can be confident I've done my work.
Great
Thanks, Marty.
answer. Thank you,
And
Marty.
we actually have Don Bonner, who is he's a city councillor from Nanaimo on. I'm not sure if we can actually hear Don, but he does ask Marty why it's not fun presenting to council sometimes. What do you want as feedback from council? What would you ideally have? I don't know if you want to take that one.
Why is it not fun? I can't, was it Don? You're a funny man, Don, because council, they're tough to go in front of. It's like any politician, because as a politician, they are not experts in all of these different fields. They represent the community, right? And so they rely on administrators to come to them with solid information and answers, right? And processes that they can trust to make good decisions. And typically you go before a council and they ask you the tough questions. They beat you up. But you know what? I appreciate it, because if you're prepared and you do your work and you have the answers, you will gain that trust. It's no different than appearing before a judge as an officer when I'm in a trial. If you have no credibility, if you haven't done your investigation, if you haven't done your work and you don't have your ducks in a row, the lawyer and the judge are going to kick the crap out of you. Okay? You're going to lose credibility and trust. It's no different than appearing before council. You will gain a reputation. But is it fun going through that process? No. Because again, council, they're not experts in any specific field. And the one beef I do have with council, and this is Canada-wide, is they, not always do they read the information. We assume that you do all this work behind the scenes and that they read it and digest it and they're well versed in it. I've got news for you. They don't. They can't. So, don't be offended when your council has not read the 300 pages of work you've done. So that's why it's so important to do all this background work and present it in a clean manner.
Thanks, Marty. That's great. So there was a question about the HIFIS pit. Is there a repository of data for a region, and how can a reporting party get access to it?
So I don't know if we have somebody from Reaching Home here and the HIFIS team, by all means, please jump on the chat and correct me. What we were talking about is the HIFIS PIT module, which is a web-based tool for the survey questions that what we're proposing to do for the Alberta 7 cities is that we would use that as the data collection so that you don't have to do things on paper. It automatically goes into the I guess repository, for lack of better words. And then that repository with all that data for your region, that with all those surveys, is connected to our platform to write the reports automatically, essentially. So that's what we're doing so that we can do things really quickly rather than pulling the data, cleaning the data, writing it in Excel, screwing something up in Excel and having to start over again. So we're kind of streamlining that process. And that's what we're kind of encouraging other people to think about as well, because that tool's there. It's free from the HIFIS team if you're looking for something web-based for your survey. If you don't have connectivity, that might be a challenge in some communities around internet. And if so, you might want to have backup paper copies with you and then put them in later like you would as on a SurveyMonkey. It kind of looks like, it's like a SurveyMonkey, but with PIT, essentially.
Okay, and then there was a question that came through about what types of mental health supports are needed for this area. I'm assuming when the question is referring to PIT counts, so what type of mental health supports are needed?
That's a good one. We're usually in training, so I'm just going to speak PIT specific, and Jesse chime in on this stuff. But because in homelessness, we could have a whole webinar on mental health and homelessness, and we're not going to do any justice in the next 30 seconds to that topic. But around the PIT in particular, you should be incorporating some mental health and just recruiting folks from the homeless serving sector that have nonviolent crisis intervention skills for the enumeration, the street level enumeration in particular. And usually communities like to have that, one of these folks that have that background in serving the vulnerable population, which is inclusive of mental health skill sets, etc. And having those guys be the leads in those teams of volunteers if you're gonna be doing that street level enumeration. And then there's usually a component around mental health and like I said, nonviolent crisis intervention. There's usually a presenter that has that background that does some of the training with volunteers, so just kind of what to expect when they do this work. And then there's usually also a public safety person, somebody that's representing RCMP or the local police, that just gives people tips around what to look for as well. Jesse, anything from you?
No, I just see Dr. Christie said I'm also interested in the role of civil society. I think as for the mental health comment.
Yeah, well, so the civil society connection on the PIT is a great one. That's usually where people get recruited for volunteering around the PIT as well. So it's a bit of an engagement tool for volunteer groups to come into this work. Now with COVID, that is obviously not going to look the same way either, so that it may not be the most appropriate place to recruit people that might have vulnerable health conditions, et cetera. So you got to be really smart about that. And even the grouping of volunteer teams. So if possible, to have people from the same bubble, for instance, to be on the same team, if that's so in your volunteer recruitment, thinking about that a little bit. And that's, again, also civil society related, because it's about informal supports. Like I said, we're not going to tackle civil society's role in homelessness in this webinar, just because it's on the point in time count, but those are some of the initial remarks. Reaching home, Saji wanted to say that they're going to provide the HIFAS support team email, and it's right here, support@hifas.ca. If anybody has any questions around that PIT module and using HIFAS. And yeah, thanks again to the Reaching Home team that's been super responsive to make this happen and keep improving that application, because last time around it wasn't quite there for the 7 cities, but we're hoping that it's going to hit the mark really well this time around.
And I'll include that email address in the follow-up email as well that I send out to everyone. So it looks like we're all caught up on the questions. So that's great. Thanks so much, everyone, for tuning in. I'm just looking at the time. We've got 2 minutes left. If there's anything else, Alina or Jesse or Chantal or Marty, that you'd like to say at this point, feel free to chime in. Otherwise, I think we're close to signing off. So
awesome. Oh, thank you. Thanks, everybody. Really appreciate your time this morning, and please reach out to, I'm going to put it all on Jesse at helpseeker.org, because she's like I said, she's the PIT queen. She officially took that title from me as soon as she came on the scene. So I'm happy to defer to her expertise. She's been in this in the trenches much more than I have more recently. Marty or Chantal, or I think Marty had to run to his council meeting, but yeah.
No, I'm good. Thank you so much. New updated survey for the point in time count coming next week. Rachel, I think, is your contact for that. That racial identity question is a core question now.
Oh, wonderful. Good work. Good work. That's excellent. Yeah, and there's a couple other resources around COVID and how to tweak your methodology. We'll send all that stuff so that you guys have it all in one place, including the recording and all these different tools that have come up. So thank you very much. We really hope to see you guys again when we talk about, now what, and what does this mean for policy and practice change? What are the systems change activities that you could be undertaking now that you understand what's coming down the pipe in terms of numbers as well. So thanks, and have a great rest of your week, and we'll see you next time. Bye now.